everyone. This is Jennifer Salazar from the Houston Better Business Bureau Education Foundation. Thank you so much for joining us today. So the scam of the month for August 2021 is cardiovascular genetic testing. And I bet you're thinking, genetic testing, this is not new. I've heard about this for a long time, and you are correct. And you are correct about the genetic testing scams. This is not new. In fact, we covered this last year in September of 2020, but we covered Medicare genetic testing. So this is a whole new variant of genetic testing. And some of the examples from last year of genetic testing was basically a company would offer you a free test without your doctor's approval, okay? And then they would bill that to Medicare. And the test went by so many different names because at the end of the day, they just want your Medicare number. So they're going to use a name that is going to pique your interest. For example, cancer screening. Say if you have a family history of cancer, they're going to contact you offering you a cancer screening or a DNA screening, dementia screening, and the list goes on and on and on. So what is the difference between that scam and this new scam? Well, basically swap the word cancer for cardiovascular. Same exact scam, my friends. Instead of using the word cancer, they're using the word cardiovascular issues. And this is also going by so many different names, like cardiac genetic testing, cardiovascular genetic testing, comprehensive cardiovascular panel, and the list goes on and on and on. Instead of targeting folks that have histories of cancer, they're targeting people that have history of cardiac issues or family history. And you know the deal. The deal is, at the end of the day, no matter the scam, scammers want your Medicare number because those numbers are worth at least $30,000 a day. In fact, I bet you didn't know that every single hour, Medicare is losing $7 million to Medicare fraud. And the way this works is the scammers are offering Medicare beneficiaries these genetic tests by using a cotton swab or a cheek swab to obtain their Medicare information, again, for fraudulent reasons. Also, Medicare can deny these tests, and a lot of beneficiaries have been left with bills averaging between $9,000 to $11,000. In fact, the fact at the end of the day, and this is so important, these tests, cardiovascular genetic testing, is covered by Medicare when the test is medically reasonable and necessary. And please get it through your doctor. Only your doctor can offer these tests, period. So let's come together as a community and stop cardiovascular genetic testing today. These are the steps you need to take, and these are the steps you need to tell your family, friends, and neighbors. Number one, be sure your doctor has assessed your condition. Although Medicare may cover genetic tests to detect heart disease, these tests do not predict or screen for cardiovascular diseases. Number two, do not give your personal information to anyone who calls you claiming to be from your cardiologist's office. Period. Do not give out your personal information or accept screenings services from anyone at community events, local fairs, farmers markets, parking lots, or any other public event. Period. Remember, your personal information is private. Don't give it out. Always read your Medicare summary notices or your explanation of benefits. I want you to really focus on these words, gene analysis, things like that, or laboratory, because this could be red flags of this scam on your Medicare summary notices. And last, if you receive a cardiovascular genetic testing kit in the mail and it was not medically necessary, please report it right away to the Senior Medicare Patrol. Also, read your Medicare summary notices, and if you see anything that looks odd with the billing, again, please report it to the Senior Medicare Patrol. 3 words to save you from every single scam, including this new one: Protect, detect, and report. Protect. You have the power to keep your information private. And I want you to do the following. I want you to treat your Medicare card like a credit card. If someone called you asking for your credit card information, would you give it to them? No. You should treat your Medicare number the same way. You should know that Medicare will not call you over the phone and they will not visit you for anything. You're going to get a call from Elvis or from the Queen of England before you get a call from Medicare, because it's not going to happen. Be cautious of offers using the word free medical services, because at the end of the day, there's nothing in life free but your mama's lovin'. Somebody is going to pay the price. Did you know that Medicare loses $60 billion a year? That's $7 million an hour. There's nothing free. Watch out for identity theft. Ways to watch out for identity theft is as simple as checking your mail. If you're getting credit card offers that you don't recognize, if someone is filing taxes in your name, there's so many indications of identity theft. Also, you can pull a free credit report once a year to make sure your identity is safe. Read your Medicare summary notices. If you don't recognize the doctors, if there's double billings, that could also be a red flag of identity theft. Please be part of this community. Pass this information on. Now, I don't want you to do the following. I don't want you to give out your Medicare number except to your doctor or your other Medicare providers. And please do this in person. And please do not carry your Medicare card with you unless you absolutely need it, because a lot of people may lose their Medicare card or their purse or wallet may be stolen. Now that we know how to protect our information, let's learn how to detect our information. So let's become Dick Tracy. I want you to review your Medicare summary notice, and I want you to look for these red flags. Number one, services that you did not receive. For example, if you've never had home health care, but you're being billed for health care, home health care that is, that's a red flag. Another red flag is double billing. If you've been billed multiple times for one event, that is definitely a red flag. And finally, watch out for services that were not ordered by your actual doctor. Usually we get our Medicare summary notices in the mail every quarter. If you like to use the computer and the internet, you can actually access your Medicare records more. You could go to www.mymedicare.gov and actually look at your Medicare summary notices in lifetime. And last, use your personal healthcare journal. When you go to your doctor's office, write down the appointment date, write down what the doctor did, and write down any copay you may have. Then I want you to take that when you get your Medicare summary notice, and I want you to compare the two. Anything that doesn't look right, I want you to do our last step. And our last step is report. I want you to call the provider, say, this isn't matching up to my personal records. Gather the information and the documentation, and when in doubt, check it out. Contact the Texas Senior Medicare Patrol at 1-888-341-6187. This is a free and confidential service. Wait a minute. I said the word free. Remember what I've been saying through this whole presentation. Nothing in the world is free but your mama's lovin'. That is true. The Senior Medicare Patrol is a federal grant through ACL, which is the Administration on Community Living. Taxpayers paid for this service. So please use this. Use this service. If anything does not look right on those Medicare summary notices, please call us at 1-888-341-6187. Thank you so much for joining me for the August 2021 Scam of the Month. Again, my name is Jennifer Salazar with the Texas Senior Medicare Patrol, and I'm also with the Better Business Bureau Education Foundation in Houston, Texas. The BBB Education Foundation in Houston has the federal grant for the Texas Senior Medicare Patrol, and we cover all 254 counties in the great state of Texas. Again, if you need to report Medicare fraud, error, or abuse, please call us at 888-341-6187. You can always call me directly at 713-341-6187. 6184. And you can always email me at jsalazar@bbbhou.org. Thank you and have a great week. Bye-bye.